New videos every day.
Okay, this is Athena Jezik, and I want to just bring forward a little bit of work about this low back because a lot of people suffer from a lot of low back pain. There is a joint here that comes together. In fact, I should probably show it to you on a model so you can see the gravity of it all. This is a spine, the lower back. This is the sacrum, the hip crests. L5 is down here, S1. So you can see how these joints work in here. When we sit on these sit bones, but oftentimes when we have a weaker abdomen, or we're just sitting a long time, we'll tend to roll back. The spine isn't real pliable, so you'll have to just see how we roll back onto this coccyx. And then our abdomen becomes weak because we're sitting in a funny position and we're walking around. And as our abdomen becomes more weak, we tend to fall into that position more and take a lot of the stress into the low back. We also can be pushing on the coccyx and sacrum in an odd position. These joints in here need to be fairly mobile, and they're not. And as you can see, they come all the way through. So it's a big joint piece in there that should be mobile. It should be moving with the craniosacral system. So that'll give you some idea what we're working with here. And when I have people with low back pain, I always do craniosacral work, but I do add some little things that do help to lengthen that out. One thing is we want to make sure that we can get the mobility back into the sacral area, and here is the edge of the hip and the sacrum where that joint is coming together. And oftentimes I'll just hold my fingers there with not a whole lot of pressure just to see where the lockdown is. Again, it's a matter of knowing what you're feeling for and what you're looking for and what the tissues are doing around it as to whether or not the joint is open or if it's jammed or compressed. Sometimes if this spreads into hip pain, which it can do, I often find that jaws are typically out when there's hip issues or knee issues. I have made a pretty strong connection with that. And here I'm just letting this sacral area rock back and forth a little bit. I'm letting it open up and swim around in there. When you have pain that shoots down the leg, then you're affecting the sciatic nerve. I have been able to witness a lot of sciatic pain being removed completely from just a repositioning of this sacral bone because it's been compressed into the hip crest and it's not mobile, and so it's putting pressure on nerves. Now here I've just got my hand interfaced with the sacrum and I'm giving a little bit of traction, pulling downward, and it's at a very, very superficial level, more of a fascial stretch. Seems like a lot of times the fascia and the smaller structures are the ones that are actually holding the tightest. You can get that small structure released and then the larger structures will follow. We tend to do it in our thinking. We tend to just start out far and do the most aggressive things and then forget about going little and wonder why we don't get the results that we could have. So from a cranial point of view, and other people who work in modalities closer to the energetic body understand how important and how much impact the subtle anatomy has on chronic pain. So that gave a little stretch down there to the sacral area. Then the other thing, because of the craniosacral work, is catching the fingers at the occipital base, and then also catching the fingers where the L5, S1 come together, and get the fingers down into that space, slowly going between the vertebrae there until you can access the dural tube. And you'll access it at both ends, right under the base of the skull and also there. Once you find it, access it, and you feel the connection between the two fingers, that one at each end. And you just hold into it and you give a slight traction, tractioning the sacrum towards the feet and tractioning the occipital base area upward in the direction of the eyes. And it's done very lightly. You want to stay on that membrane. What I just felt down in the sacrum was a little bit of therapeutic pulse, which signifies that the tissues are getting ready to move into a new position. And they are making their change. Feels like a lot of unwinding, a little bit of pulsing, a little bit of like wave feeling, like a swelling and then a release, like a wave in the water. And then I'm going to just give a nice straight stretch. And there's more extension happening around that area. Okay. Just little tiny work like that has been very beneficial to a number of people over the years in getting rid of this low back pain. Now, of course, there's other things that have to be done when you're working to get out of this pain, is to be careful about the activities until the positioning is back in order. Sometimes there's other modalities that are helpful to work along with this, like chiropractic work or physical therapy. But I've found over the years that just physical therapy or chiropractic work alone, if there's a lot of chronic pain to the problem, is not going to quite pull it out. At least it won't do it as quickly as if it would be done if the subtle anatomy is addressed. In my thinking and my experience, the subtle anatomy should be addressed before the more rigorous activities. However, there are also conditions and situations that there needs to be more aggressive therapy right away. So we should not get into any routine that things have to be done this way or that way, but rather look at the person that you're dealing with and figure out what's best for them, because that's what this is really all about. And it has been a very, very delightful job to be part of watching people get out of pain and resume back to their lives. Even conditions like serious stenosis in the low back, craniosacral work can keep the person going. I've experienced that as well, where this particular individual would probably have been in either a walker or a wheelchair several years prior, but the craniosacral work kept him working and actually got him to a point where he was able to even go back to doing some yard work. Unfortunately, though, his workman's comp wouldn't pay for the craniosacral work, and he was unable to continue, in spite of the fact that it was definitely keeping him working, because it wasn't an approved protocol for what workman's comp is all about. So perhaps we can discuss at another time what it is we really want in our healthcare system, how we want to deal with health in America, and maybe we should just scrap the whole idea of the government giving us health care or insurance companies telling us what we can and can't receive. And maybe we should really consider objectively and seriously notion of maybe being responsible for ourselves and taking the time to learn what other modalities and good nutrition can do to maintain health. Plus, it's a lot of fun to feel good. Okay, so she's got more mobility and tissues are nice and soft. There was a nice decompression, a nice lengthening that occurred. So I'm sure that once she gets up and moves around in a couple of minutes, she's going to have more flexibility and more sense of range of motion. This is the hemogesic, and we just demonstrated the low back.